Hi, I'm Aurora Chen. I earned my MBA and Master of Public Health and Health Policy Analysis from Washington University in St. Louis, and I'm now an analyst at Brastex Health. Brastex Health is a boutique consultancy that guides biotech and pharma teams in identifying the most meaningful, pragmatic, and equitable approach to clinical development, using perspectives that reflect the diversity of the patient populations being served. One of our core strengths is providing our clients with clarity of vision across the clinical development landscape in China. As the world's second largest healthcare market, developing a competitive advantage in China can mean access to a large concentrated patient base, lower cost of manufacturing, and a potentially less stringent regulatory landscape. I want to share one example of how we recently guided a client to tap into these opportunities. First, we developed insights into the commercial objectives of the client's key competitors in China. We developed these using company press releases, Chinese clinical trial databases, Chinese versions of company websites, and official WeChat accounts. Next, we elucidated each of their competitors' strategies to reaching these objectives, such as whether the company was relying on their in-house teams or if they were outsourcing execution through partnerships with local organizations. From here, we used our primary intel network in China to gain insights into competitor positioning and key areas of differentiation. For example, product attributes, pricing, discounting, and market access in rural versus urban settings. At the same time, we gain insights into patient segmentation and clinical workflow barriers to implementation at the customer level. Finally, using a combination of primary intel and Chinese databases such as Yaozhi, we developed context and insights into pricing strategy and policy trends. This included a detailed view of the payer environment and differences in OTC strategies by city tiers. As part of this engagement, we also attended the annual conference of the Chinese Society of Clinical Oncology, or CSCO, to pressure test our takeaways and gained a deeper understanding of discounting strategies by region and market segmentation by hospital class. As for the result, our client gained visibility into their addressable market in China and the specific strengths and weaknesses of their competitors there. Because we were able to articulate detailed examples of their competitors' interactions with the NMPA, with customers, and with the annual reimbursement negotiations for the catalog of medicines covered by local insurance, our client was able to learn from others' mistakes and build their own strategies based on best practices. With these insights, we created a unique value proposition and roadmap for our clients to build goodwill and increase their revenue by paving their way into this fast-growing market.